Immunization against vaccine preventable diseases through the National Expanded Program for Immunization is one of the most effective measures of reducing morbidity, disability, and even mortality in the population, especially in children. Let's look at Ghana. So Ghana currently has 12 vaccines in the immunization schedule, namely BCG, oral poliomyelitis, diphtheria, pertussis, tetanus, hepatitis B, Haemophilus, influenza type B, pneumococcus, rotavirus, measles, rubella, and yellow fever. Newer vaccines may be introduced in the near future as they are discovered and found effective. Immunization is recommended for the following persons: high risk groups, for example, during a disease outbreak or by virtue of being exposed. Also, in young children, elderly, and in the malnourished. The current schedule for routine immunization for children under 5 years is as follows. So, at birth, vaccine, and then the dose: give BCG 0.05 ml intradermally, and polio O, that's oral, 2 drops orally. And 6 weeks, give 5-in-1 or pentavaccine 0.5 ml IM as intramuscular. 5-in-1 vaccine or the pentavaccine contains diphtheria, pertussis, tetanus, Haemophilus influenza type B, and hepatitis B antigens in just one vaccine. So at 6 weeks, you also give pneumococcal as PCV 1, give 0.5 ml IM as intramuscularly, and also polio 1, you give 2 drops orally, and you also give rotavirus like Rotarex as also at 6 weeks. At 10 weeks, you give 5-in-1, that's 2, or pentavaccine 2 as the second one. You give 0.5 ml intramuscularly IM, and you give PCV 2 0.5 ml IM, and you also give polio 2 as 2 drops orally, and you give rotavirus Rotarex. And at 16 weeks, you give 5-in-1 2 or pentavaccine 2, and you give 0.5 ml IM, and you give PCV 3 0.5 ml IM, and you give polio 3 2 drops orally. 9 months, you give measles or rubella 0.5 ml deep SC subcutaneous or IM, and you also give yellow fever 0.5 ml IM. At 18 months, you give measles 0.5 ml deep SC subcutaneous or IM intramuscularly. Okay. Normally, measles rubella is presented as a combined vaccine. So some few things to note about vaccine use. Wrong method of administration reduces efficacy, and if immunization course is interrupted, resume with the same brand of vaccine, else restart with different brand. There are no contraindications to the immunization of the sick child if he or she is well enough to go home. And children with diarrhea who are due for oral vaccines, give but don't count, then repeat after 4 weeks and record this one as given. And don't give OPV as oral polio vaccine. After 15 days, it disturbs regular immunization schedule, and don't give Rotarix first dose after 12 weeks and second dose after 24 weeks. Okay. So immunization of preterm babies. Consider all premature babies for full immunization course. You start immunization in second month after birth, as after 4 weeks, and irrespective of degree of prematurity. You give BCG on discharge, delay OPV in neonatal unit since there is a small chance of transfer of OPV virus to other babies. Hence, give OPV on discharge from nursery, not while still on admission. There's a few contraindications to immunization. Current serious febrile illness, you have to delay vaccine. History of severe reaction after previous dose, for example anaphylactic reaction, you have to avoid. And also evolving neurological disease, for example uncontrolled epilepsy, avoid whole cell pertussis vaccine. And no DPT or DPT, HEB, HIV, as diphtheria, hepatitis B, and Haemophilus influenza type B to child with convulsion or shock within 3 days of the most recent dose of diphtheria or diphtheria, hepatitis B, and Haemophilus influenza type B vaccine. And no DPT or DPT HEB or HIV, that's diphtheria, hepatitis B, and Haemophilus influenza type B to a child with recurrent convulsions or active CNS, central nervous system disease. Yellow fever vaccine should not be given if there is history of anaphylaxis with ingestion of egg. And individuals with symptomatic HIV infection should not receive BCG and yellow fever vaccines, since these are live vaccines. BCG vaccine can be given at birth since the HIV infected newborn is asymptomatic. Live vaccines should not be given in the following: so pregnant women, and there is risk of teratogenic effect. Patients with malignant disease, for example leukemia, Hodgkin's disease, you don't give live vaccines. Malignant disease of the reticuloendothelial system, and also patients with immune suppression, including symptomatic HIV patients, and patients on chemotherapy defer for 6 months after stopping chemotherapy treatment. However, measles vaccines should be given to HIV positive patients, even though it's a live vaccine, because the benefit outweighs the risk. Referral criteria: refer all problems related to immunization to a pediatrician or EPI specialist.